Mr. Divine Logo. Is Mr. Logo here? Excellent. Prof. Amos La will be joining us online. I'm sure Prof is ready by now. Then Mr. Labran Musa, please join us as well. Last but not the least, Mr. James Amwa. To moderate this particular session would be Mr. Geoffrey Okansi. Mr. Okansi, good. Can we do this in 20? We'll do that. Thank you. I trust you.
So good afternoon, ladies and gentlemen. Respectfully, my panel members have been mentioned, and time is not our friend. So we'll go from top brass. I'll go straight up from my right, and I'll come down. I'll go to Labram for host to steer the conversation, and then Labram will steer the conversation, and then I'll still start from his left-hand side, and I'll come down to this direction. So briefly, I know you can do this for me in a minute. What's your understanding of environmental commercial determinants of health? Box that with, does it have any health consequences on the public health? If you could just
right. So thank you very much for the question. In fact, this is a very broad question, environmental and then commercial determinants of health. But I will leave the environmental to the other panelists. I will go to my favorite, the commercial determinants of health. And obviously, once the commercial comes in, then everybody knows what we're talking about. We're talking about industry interests and how industry activities have impacted negatively, on our health. And as I mentioned earlier, one of the reasons why we are sitting here today is because of industry activities. And basically, I'm talking about health-harming industries. Industry that produces products, commodities that do not inure in the interest of any of us, economically, health-wise, socially, everything you can mention of. These industries are there to make profit, for their families and their individual. In fact, they care less about what we go through, what people live with NCD go through. That's the reason why there has been much talk about how do we ensure that we are able to relegate or speak more about industry interferences so that we identify them and know how we are able to deal with them in the course of our work, in the course of our operation. Indeed, we all know today, if someone tells you that a cigarette is good, or a cigarette is not good because of the effect that it has on human being. Similarly, if you ask me, I'll tell you that I don't even take in alcohol. Because God in his own wisdom, I know many people challenge this one. God in his own wisdom, has made, the food we eat and everything that has alcohol inside already. I remember there was a discussion on TV. Mostly you hear doctors. And sometimes I definitely want to debunk this idea that excessive drinking. I think that we have to change the narrative. Because, you see, WHO have just declared that because no amount of alcohol is safe for the human body. So, indeed, no matter the level of alcohol that you take, it has an effect on you. So, what I would rather expect the clinician or doctors to be talking about is that if you think that the human body needs some aspect of alcohol in their body, then let's make it prescriptive, right? So that you come to the facility, I diagnose you and say, okay, your alcohol level is low. Then I give you a prescription. You go to the pharmacy, then you take fine. Then take maybe 2 thoughts, 1 3 times daily, 2 3 times daily. At least I believe that would help. The cause rather than saying excessive drinking. But of course, we'll see the effect that these products are having on us as people. So it's about time we look at that and look at that very well. Thank you very much.
Right. So I'll take your take on same.
Yeah, okay. I think you said you were leaving a certain portion out.
Environmental.
Yes,
Environmental
environmental. Okay. So looking at the environment of the situation we find ourselves in, I'm not now talking about the environment as trees and the weather and all that. All right. So I'm talking reference to the issues of diet and the issue of what you see out there, the commercialization that you see. In one breath, many years ago, I could say probably 20, 30 years ago, people were yearning. Whenever they are talking, they will say, if you are outside Ghana, if you are, you go to London, you go to US, it's almost like you wanted to be like them. Now you are like them. In your environment now, what is it that you can get outside, in terms of if you were in Europe, that you can't get here now? It's there. You can easily order it. So some of the environment you are talking about could even be something that is, electronic. The things you can order, the things you can easily get your hands on. And then you see the marketing that goes on. People want to sell. People are thinking business. They don't care really what happens to you so far as the money would flow. So we are really in a certain time that we are faced with issues, of bombardment, I would say it, of various interests. And I'm coming from the Food and Drugs Authority, so my focus is more on the issue of diet, the issue of what can happen to you. Right now, it was very interesting. We went to lunch, and I was looking at the bowls, how people were heaping. How people couldn't eat what it was, but they were heaping, and they were sitting in front, and as if they were going drowsy. I can even see the eyes, even all good. But you see, it just tells you that it's like grabbing. But in the grabbing, you then find out that I was looking at some plates because I could see the jollof. I could see the wache, okay, yeah, plain rice. We can do a list, and then I wasn't seeing the vegetables much. It was getting in the way of some people. In fact, when they finish and they are leaving, and then they see that other people have something on there, then they remember, and then they turn, and then they go and pick, and probably they can't eat. So in the end, what you have taken inside you, there has been a kind of a commercialization because inadvertently we are paying for what it is. So it's like now grab it. So in your grabbing, what are you doing to yourself?
They all have a role of promoting the development of NCDs in our lives. The other one is galamsey and water pollution. When I was doing my dissertation for my master's program, I did a systematic review on the effects of small-scale illegal mining on our health in Ghana. One of the papers suggested that if you measure the mercury content in those who work in these galamsey areas, it was higher than the amount that we could say is bearable. And also, for those who develop kidney disease out of that, and I like that because I work in a dialysis unit, and I see a number of patients who come with kidney disease. You trace their social history, either they work within the galamsey areas. And there's a study from one Dr. Puff, I think mentioned some time ago, that the fish we eat, for example, those of us who enjoy eating the head of fish from the rivers, the grills have a lot of mercury content in there. The bones from the fish that we eat have a lot of mercury content in there. So you may buy fresh fish from water. You don't think, galamsey hasn't got into Accra. But the fish we are buying from these fresh waters all contain mercury, which affects our kidneys and leads to kidney disease. So
I'm sure this is not a threat to me, though.
It can be a threat to you because if you like in the head of a fish and the grills, then
I'm giving myself and the audience hope.
Yeah, so that's how we need to do that. And then the second thing I want to talk about is where we can make healthy foods accessible to people.
Right.
And that's why during the project we did with Prof. Salah, we went ahead to promote the part of the Excise Duty and Amendment Act that brought tax on sugar sweetened beverages.
Okay.
We must make healthy foods accessible and cheaper.
Right.
If we go to our schools, for example, and children want to go on break, what do they get to buy? Biscuit, drinks, and those are available. But we must make sure that the country as a who has a policy that will take away this unhealthy food from our rich or make it more expensive to buy those ones, but make sure that healthy foods are all available.
I'm sure I'll work on exercise, Labram.
Yeah, the
I'm sure that'll
results.
do.
Exactly.
Prof. La, let me come to you because I don't want to take the risk of my early experience from the hall. We had some early experiences. So, Prof, if you can shoot 3 minutes, since you are not with us here, shoot straight 3 minutes and look at the way forward so we can come back home.
Thank you. Thank you. Thank you. Please, can you confirm that you can hear me?
Perfectly.
Thank you very much. First of all, I'd like to express my gratitude to NCD Alliance, the Ministry of Health, and other co-conveners of this event for tabling this very important topic to be discussed, but also for giving me an opportunity to contribute to the conversation. To begin with, I would want to be fair to everyone and note that there is no doubt that commercial entities can have positive effects on our health, on our society. For example, through some of the products and services that they offer. They are beneficial. In some instances, they are even essential. However, as Labram indicated, there is now almost an overabundance of scholarship that speaks to the fact that commercial entities, particularly large multinationals and transnational corporations, have increasingly negative effects on our health. I'm talking about human health, but even planetary health. And they also promote, social and health inequities. That is also clear. In a very recent series, a Lancet series on commercial determinants of health that I had an opportunity to contribute to, in paper 1, those who authored paper 1 conceptualized or defined commercial determinants of health as systems, practices, but also pathways through which commercial actors drive health and equity. That definition appears to be neutral. So they can drive health and equity in 2 ways. They could impact health negatively, but as I noted in my introductory remarks, there's also evidence that they impact health sometimes positively. In other words, when we're talking about commercial determinants of health, we're talking about the influence of private or for-profit oriented sectors, so such as food and beverage industries, tobacco, alcohol, but even pharmaceuticals that produce the medications that we use. And so to summarize, their effects, in other words, the effect of commercial determinants of health on health, and therefore universal health coverage, can be direct, and I'm sure you are familiar with that, but it can also be indirect. The effect can be positive, it can also be negative. And sometimes you could even have actors within the private sector whose effect on our health can be neutral. So let me give just 2 examples. If you take, for example, impact on their activities on disease burden, if you take some of the contributions from pharmaceutical industry, no doubt they can have positive impact. The medications and health products that we use sometimes are used to reduce disease burden. So that's a positive impact of commercial actors on our health. But the negative impacts are also glaringly clear. Industries that are associated with unhealthy products, as Labram noted earlier, tobacco, sugary beverages, can contribute to high burden of non-communicable diseases, which are clear, and therefore will lead to straining of health systems, impacting universal health coverage negatively. In terms of policy, and it's something that civil society organizations have been battling for years, industry actors can influence, can oppose, or interfere with policy development and policy implementation. So they can oppose even the initiation of the policy to be enacted in the first place. or they can delay the process. And sometimes when they fail in opposing it, the initiation, they fail in delaying it, and it is passed, they can frustrate implementation. So all these are ways that industry are focusing on their negative impact on human health, but also planetary health, and how that can affect commercial determinants of health. And so it is very crucial for stakeholders within the health space to recognize these, not only just the positives, as that's what they would always say, but also recognize that their activities can impact us negatively.
Right.
Just one more minute to summarize way forward, which I think is even more important than the background I've given.
Prof, I'll do 30 seconds.
In the paper that, yeah.
Respectfully, I'm going to do 30 seconds on that.
Okay, so way forward, what do? We identify 4 actors and some of the things that they can do to overcome or counter this. If you take government, I'll just give one and then move on. So government and international organizations, we call upon them to develop an international, global convention to counter commercial determinants of health, just as we have the WHO Framework Convention on Tobacco Control. If you go to researchers like me, it is our responsibility to expose the health, harmful policies and practices. So naming and shaming. If you go to civil society, and I would end here in the interest of time, we would want you, as you usually would do, to make some noises. You have to be noisy, publicly support evidence-based, health measures, but also call out on this industry for the negative things that they are engaging in. Over.
Very good landing, Prof. That takes us to industry interference, research, and evidence. So, Divine, I know that's your passion. Drive us through that one.
Thank you very, very much. It's rather unfortunate we do not have enough time to really digest this very properly. My colleague talked of the environmental impact. He talked of the environmental pollution. That is the environmental determinant of health. Air pollution is one of the issues. And I believe at this level, what we try to do is to create that awareness among the populace to know that this is a challenge. And before we pass the Tobacco Control Act, you think that the people who have effect on tobacco is the people who smoke. We did a study among people who work in this hospitality industries, the restaurant and what have you, to really assess their level of exposure to nicotine by taking their hair product, their blood samples and what have you. You realize that their nicotine level was so high. Those people who are selling, bar attendants in those restaurants, nicotine level was so high than normal. The WHO have a standard that you compare the level of nicotine that you're supposed to have in your system. But it was so high. You understand? This is the challenge. If the people are not aware that this is a danger to them, how would they be able to protect it? And how can they be able to make the noise for what? Proper policy to be taken. When you go around, you see the shisha being smoked all around. You see the electronic cigarette everywhere. But you think that you are not concerned because you don't smoke it. But I can assure you, your few minutes or few hours stay in that facility alone, you have effect. Even sometimes when you don't smoke, if they are not smoking under pressure, we have what we call third-hand smoke. The particles are being hung around in the environment. You will go in there and you imbibe this into your system. Let's go to the next level, which is so scary. That has to do with our agricultural practices that we are having currently in Ghana. We are using high level of inorganic fertilizers. Please, we are now being advised to take more fruit, more vegetables. But please, studies have been done. If you see the level of chemicals that are in those things that we are taking into our system, it's not surprising that my colleague said he worked at the renal center. It's not surprising to see very young kids, young girls. In fact, when I'm watching the TV, a lady as early as 18 years on dialysis. What is the problem? What is the cause? Such sicknesses, honestly, are, sorry for me to say, are for the aged, all right? But now it's for the youth. You check the background of that person. That person doesn't smoke. What? It doesn't take alcohol. So where are those things coming from? We are seeing what is called climate change. It's also one of the environmental determinants of health.
Right.
Let's talk about this. From January to now, tell me, which month that did not see rain in Ghana? This is the time that we're supposed to be having a dry season, but right now it's already started raining. What is the problem? My village has been highly hit because of this environment, the climate change. I'm from, my hometown is Mepe.
Right.
Just because of the climate change. But what is the drive? What is driving this? It's all because of the current practices. We call it modernization or what have you. That is the problem. The last one I want to talk about quickly because of time, urbanization. That is another thing that is driving all these challenges that we have as far as NCDs are concerned. Urbanization. This kind of lifestyles that are going on, westernizing our life, high level use of alcohol, sugar sweetened beverages, thinking that that's the better way to live, and then electronic cigarette and shisha. I think maybe we'll continue in that tangent. Go ahead.
Right, so I'll take yours, but as you shoot, give me the way forward so that you give your final talk in there. Then I sweep to 30 seconds for them.
Okay, thank you very much. Taxation has been used as a tool to control the consumption of some of these harmful products. For instance, tobacco and sugar sweet, first carbonated soft drinks. Now, the Excise Duty Act 2014 listed some of these products beyond tobacco and carbonated soft drinks for excise duty. What have we done differently from this year? One, the duty rate on tobacco has increased, and we have introduced the hybrid. What do I mean by the hybrid? Now, a pack of tobacco attracts both specific and ad valorem duty rates. In essence, these are charging methods, but eventually will make these products very expensive. That is intended to discourage consumption. We have a narrow description of products categorized as carbonated soft drinks. That has been expanded now to be sugar-sweetened beverages. So we are not only targeting carbonated soft drink, but we have expanded the coverage and also increased the tax, the duty rate, excise duty rate on such products. We are well aware of the kind of reports, the kind of feedback that we get from our medical institutions, the kind of negative impact that the consumption of these products are having on us. And there will be the need as a way forward to use tax mechanism to control access. Access physically, access in terms of finance, affordability, two in one. If it's expensive, perhaps that will curtail access to some people, and others may advise quitting. The way forward is for us to work hand in arms, educate our people, let the picture be clearer to them that these goods are not for fun, they are real danger, and sometimes the cost of treatment, it's not easy to bear.
So let's take a 30 seconds, I guess.
So,
30 seconds.
So what is the way forward? What is the way forward? Health promotion, and sensitization. We really need to create that awareness to our people.
Right.
Now, one of the days, quickly, how do we farm? You have to quickly clear the land. These days, farmers don't clear land again. They spray with chemicals. They plant their food. They still use chemicals as fertilizers again. And then they use the same chemicals to control the weeds. So by the time the food comes out from the farm, it's so already destroyed. And that is what we eat into our system. What do we need to do? In fact, we need clear policy direction. Clear policy direction. And again, Prof. Last said that we need to create awareness and make the noise. If you see that we are all at risk, then we'll make the noise. I believe Ghana is a country that is so quiet. We don't talk. And many of us are divided on political lines. So any person in power, we don't want to talk. If your party is in power, don't talk about it.
Right.
But at the end of the day, we are all going down the drain. So let's make the noise and make the health promotion. Let's create awareness among our people that, please, that is not that. Prevention is what? Cheaper than
Cure. Right. 30 seconds.
Thank you.
Take me
Quick
home.
one. I'll start by saying, as individuals, let's take our health serious. Before you eat anything, check whether it's good for you or not.
Right.
Know where you buy your food from, because it's very important. It may hurt you. I want to say that for us and also for policymakers, we need to, and I'm happy they mentioned the wellness clinic. Wow. We must also make sure we have infrastructure that facilitate physical activity. Right. If you want to go out at dawn to do jogging, you cannot on our roads. They are dark, there are no pathway for passengers, and persons trying to walk, a car may knock you down and you are dead. We don't have parks anymore. All our parks have been converted to buildings, and we don't have places to play. The way our houses are even built, go some areas, children cannot even get a place to play. They, from school, enter their rooms, they are locked, and they're in their room till the next morning they go to school. Right. You should see how we can, with the help of our urban development agencies, assemblies, to look at all of this.
Influence our planning.
Right. Sure.
Right. Mr. Labram, 30 seconds.
Yes,
The way forward.
The theme for this year's high-level meeting is how do we collectively achieve UHC, the universal health coverage. In essence, how do we ensure that we are able to reduce the out-of-pocket payments for people when they go to the hospital? How do we ensure that people live with NCDs would get better care, or their condition will be part of the benefit package of the National Health Insurance? So the long and short of it all is that commercial determinants of health have everything to do with this problem we are facing. If you are able to prioritize prevention, and like I said, and I agree with my brother, promotion and prevention is the key word. How do we uproot the root cause? That is why I'm always for the issue of taxation, measures that will reduce or that will ensure that we don't expose our children to unhealthy stuff. Once we do that, indeed, we'll reduce the number of patients who will go to the renal center, the number of people who will go to Kolebu for chronic conditions. Right. And eventually we'll be able to achieve the UHC we are all calling for. So I would advise that we should all be proponents of prevention, and prevention. Thank you.
Right.
Yeah, thank you very much. I think all week what I've been hearing is what is Food and Drugs Authority doing about it? What is Food and Drugs Authority doing about it? Especially those that are in the diet-related areas, yes. And there's a lot that we are doing. The issue of awareness creation, as my fellow panelists have said, is something that we do and we keep doing in radio programs. The Chief Executive, Dr. Dilis Darko, we keep on doing these debates in the various markets, not only in Greater Accra region, it's all across the country with our regional offices. In fact, with what has recently happened to those who had this problem with the spill that happened. Yes, spillage. Yes, we've even approached them, looked at the issues, of food, because, we got water that, mixed up with everything. So we had to stop certain sachet water plants and the rest so that they don't have some of these problems. I would also want to commend those who are in, the consumer associations. Right. However, in my opinion, I think that it's a weak setup that we have in the country. And a lot of us like talking. In fact, one of my bosses one time said that Ghana for it is time that we get up and then we face the truth, and then we also demand of the various bodies, not only FDA, but of all other agencies that also are doing. It is time to have third parties also go around, pick and test, and then also be able to show that something like this is happening. And this galamsey, for example, menace that is going on, I think it's a kind of madness that has grabbed the country, because they say that galamsey is like a woods in a show, because if he's going down in the pit, he doesn't know whether he's coming back. But you and I know it is polluting the water as it is. And some of these problems are cataclysmic. They are multi-sectorial, that we have to sit down, we have to look at the policies, we have to find a way where we will engage everybody to be able to sit down. Otherwise, then why? And let me say, because the dialysis man is here, why would the company in charge of water say that they are having problems with turbidity? They try to clear it so that the water now becomes safe, let's say microbiologically. However, the question is that they are citing heavy metals and then they are pushing it out. Why do you think you will not go for dialysis? That is something that we really need to look at. And the advertisements and things that are going on, the FDA is now increasing the scope of definition. So hitherto, the scope of advertisement that we used to cover, which was pre-packaged, we are now going to cover the whole of food. The ones that you go to the restaurants, that you will see those big billboards that is promoting bad junk food. It's something that we're also working on. I thought you wanted solutions, because I've got more solutions for you. Thank you.
No, but don't take them away. We still have our staff around, so we still can sip from it. So finally, I'll take yours. And then
thank you very much. And our foods killing us. What, at this level, this high-level meeting, I want to toss the idea for us to begin to think about use of food seasoning, artificial seasoning in our foods. Some countries have gone ahead of Ghana to tax some of these things. Please, let's focus on this, because it appears these artificial seasonings are wreaking some kind of havoc that we are not paying attention to.
Prof, over to you. Take us virtually. Just a final take.
Thank you. Nothing to add except to reiterate what my colleague panelists have shared. I think this is a very complex problem, and therefore we require wicked solutions as well. It has to be multi-pronged. If you are talking about interventions, you need interventions from all the key actors. We need interventions from researchers, we need interventions from civil society, and we need intervention from government. Talking about government policies, and as I have noted, no single policy can address this sufficiently. We need a bundle of policies, multiple policies that are both low agency but also high agency. There are some of the things that you say, individuals, take your health into your hands and then address them. But there are just times that they are not able to do that. And they look up to our government to have policies that will protect them. We need those policies that will protect them, but we also need policies that will help or enable the individuals to then contribute to promoting their own health. So we need those bundle of policies, bundle of practices, bundle of interventions. So thank you, and over.
Thank you too. So, House, you got them clear. They were very clear that we are actually at risk due to our own choices. Also that no matter the distance you find ourselves, that pollution can happen in another town. It comes way to where you find yourself downstream. You are not safe. Economic issues. Some people go just to look for jobs. They're in the nightclubs, they are working. It doesn't mean you are innocent and so you are free. It will hook you up over there. Children are playing